ultimately, it's about people having choice and control. That's the thing that we know. My daughter has long-term condition and long-term mental health issues, and it's really about her being able to live the life that she wants to, with the support that makes sense to her, not necessarily support that services might want her to have, but support that makes sense to her, really. So ultimately, it's a life based on what really matters to her. Huge. It's absolutely huge. It's empowering. It's hopeful. People can suddenly see how they can live life in a really different way, and I think that's a really big thing. I know when I've spoken to some people who've had the kind of conversation that we talk about in personalised care, who just said it was just a friendly conversation. I didn't realise it was, anything more formal than that. And that's really, really important, I think, to be able to talk to people about. So the new long-term plan that was published in January talks about 5 major changes that we need to make to the NHS in order for it to be fit for purpose. And number 3 is about it's about all people having more choice and control over their healthcare, and where people need support, need services, it's around personalised care being implemented in order for that to happen. So that's a massive, massive policy driver for us. When you look further into the long-term plan, it talks about the way to make that happen, the way for people to have choice and control, is the implementation of what we call the comprehensive model, which is made up of a number of different components. The one that I'm most passionate about is personalised care and support planning, and that for me is a really significant part of delivering this, really. But most of those things that we talk about in our comprehensive model is really about finding out what matters to people and then acting on it. So it's asking people what matters, it's listening to people about what matters, and then it's doing it. That's a really key thing.